What steps is the Welsh Government taking to improve clinical guidance and service provision for Tourette syndrome?
Well, people who live with Tourette's syndrome encounter huge anxiety, and many are extremely sensitive about their conditions, particularly when they're out in public. And we know families have struggled to get the right diagnosis and support, and we're determined to try and change that. We're improving neurodevelopmental services, recruiting specialist clinicians, and bringing services closer to home. And we're also updating clinical guidance, making sure GPs, schools, and health boards work together so people aren't bounced around the system. So it's part of our wider plan to make neurodiverse services in Wales fairer, faster, and more joined up, so that every child and adult with Tourette's gets the understanding and the care that they deserve.
Thank you for that answer. The new film, I Swear, which is based on the true story of the Tourette syndrome campaigner John Davidson, as the title suggests, is about a man who with involuntary tics that cause him to swear. But this isn't true for some 90% of people diagnosed with Tourette's syndrome. It's a hugely misunderstood condition. Most tics are uncomfortable, sometimes painful, often distressing, and almost always exhausting. And about the same number of people have Tourette's syndrome as have autism. But as the Welsh Government recently confirmed to me in a written answer, no health board currently provides a comprehensive diagnostic and treatment pathway for children and young people for tics. There is significant variation in service provision, and there is no NICE guidance, which is a factor contributing to inconsistencies in service design and delivery. To get a diagnosis, families in Wales have to fight, and it is a fight, for referral via CAMS, which clogs up their waiting lists, and then for funding for the only specialist centre in the UK to see them, and that's Great Ormond Street Hospital in London. But even if you get that far, First Minister, and you do get a diagnosis, after a long wait, there is no support that follows locally in Wales. First Minister, this isn't good enough. Would you please watch this funny and tender film and gather NHS leaders together to agree a way forward?
Well, thanks very much, Lee, and I'm certainly learnt a lot from you there. I think I wasn't aware that the proportion of people with tics is anywhere near the same thing as autism. So that is something that I very much welcome to have that information, and clearly this is something that needs more attention. It doesn't help that there are no NICE guidelines. That doesn't help, because that means that there's a lack of consistency. What we do have in Wales is this neurology quality statement. So that takes us some way along the path, because one of the things we've got also is the Welsh Government sitting on the Tourette Syndrome Steering Group, which is led by Nottingham University. There are examples of practice being better in some areas than others. So in Hywel Dda, for example, they're piloting psychoeducation groups for parents and carers of children with tics and Tourette's within CAMS and child health. And they've also piloted a Tourette's pathway to improve access to children and young people with Tourette syndrome as part of the neurodivergence pathway. So there are examples where some health boards are going further than others, but I think probably this is an area that does need a bit more attention.